The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. This is Kipper Davis with Access. Just want to welcome you all to this webinar. I do want to ask that if you guys don't mind sitting tight for a few more minutes as everyone jumps on, and then we'll go ahead and get started. So please sit tight, finish up your emails, finish up your call, go get some more coffee, and we'll get started here in just a minute. Thanks. All right, guys, let's get this rolling. As I said, my name is Kipper Davis, and I'm an account manager here at Access eForms over the current customer space. And I just want to say again, welcome to everyone online. And just want to sit tight and let's see, make sure my screen is pulled up. Yep, there it is. All right. I just want to say again, welcome to everyone. Glad everyone can take some time to jump on, and we're really pumped for you guys to get to hear a great story of one of our customers here at Access with Halifax Health. Mr. Tom Stafford, the world famous Tom Stafford, is online with me, and I'll let him introduce himself and his team here in just a minute, but I wanted to give a couple housekeeping items, just kind of go over that before we get rolling. First off, all of you guys are currently muted, and so we will not be trying to manage everyone trying to talk at the same time today. So if you do have questions, which we love questions, if you do have questions, please enter those in the chat box over on the right-hand side of your GoToMeeting screen. So there's a GoToMeeting window there, and there's a chat box, and if you type in your question throughout the presentation, we'll have a question and answer session at the end, and we will go over those and answer those accordingly. So please feel free to provide some questions to us. I do want to say that I'm not going to be the one to bore you today, so you're not going to have to listen to me go through my spiel. You get the benefit of listening to Tom Stafford throughout this presentation. So I'm actually going to turn the reins over to him here in just a minute, and he's going to walk through the story of Halifax Health and Access eForms and what they've done at their facility. They've been an Access customer since 2006, and they started out with our traditional pieces with the IFS and EFR, the forms automation and printing forms on demand up on the floors. After that, they then expanded to the e-signature solution, and they have a really great story of how they have implemented e-signature throughout their organization and how their patients as well as their HIM staff and registration staff are benefiting from that. And most recently, they've actually made the decision to move forward with our Passport piece, our web-based form solution, and are making plans to move towards that and benefit from all of that functionality. And I know Tom will provide some additional information and background on that as well. So with that, I'm going to open it up and turn it over to Mr. Tom Stafford.
Good afternoon, everyone. To begin with, my name is Tom Stafford. I'm the CIO at Halifax Health. I've been in, I guess, healthcare IT for about 14 14 years. And in our IT department at Halifax Health, we really focus on three things, or have three objectives, which is customer service. What that means is we don't use acronyms. We always talk at our nurses level. They provide care, and we shouldn't be talking tech terms to them. We also never say no. There's probably 1,000 ways you can solve anything in IT, and so we try to give our users options on what they're trying to do or what problem they're trying to solve. Outside of that, we maintain operational stability, which means that we essentially keep the lights on and keep all of our systems running. More importantly now than ever, we need to do that, especially all of us now are deep in meaningful use, and our EHRs are more important than ever. And finally, we meet strategic initiatives and objectives, most notably, obviously, ICD-10 and meaningful use. Today, I have Holly Terry with me. She's our forms guru, and I'll also say access guru. We've been fortunate to have Holly on our team for almost 30 years at Halifax Health, and today she supports access e-forms throughout the hospital and handles access control for us. And she started out in the print shop, but we've been lucky to have her for the last 9 years. Next is Louis Giletti. He's a business analyst, and he has, as you see, like 12 years in IT. And he's a system administrator, and he also does networking. And I'd say more than importantly, he's like a bridge between the application side and the tech side. Louis knows enough on the tech side that he can really help with our platform and our networking department when we're trying to solve problems with applications. And he also manages access e-forms for us today, along with many other things. And he's been with us for 2 years, but since he's joined us, he's done a lot of great things for us too. So before I begin, I'll tell you a little bit about Halifax. We're a 680-bed hospital system that consists of 600-plus beds in Daytona Beach, Florida, at our main medical center. And we also have an 80-bed hospital in Port Orange, which is about 5 miles due south of us. That 80-bed hospital is really nice for us when it comes to IT because we're able to test new technology down there. It's a smaller size and it's much more manageable. So we get it right down there, then we bring it up to the main medical center. As far as numbers go, we average about 120,000 ED visits a year, 20,000 inpatient visits, and about 75,000 ambulatory visits. We began our partnership with Meditech in 2001. We're currently at CES 5.6. We also have LSS in our physician offices. From 2001 to date, we reached HIMSS MRAM Stage 6 in 2010, and then we started focusing on Stage 1 for meaningful use. We hit that in fiscal year 12, and we also successfully attested for Stage 2 year 1 in FY14. As far as Meditech goes, the modules that we don't have are human resources, staffing, scheduling, QMRM, ESS, cost accounting, and then oncology. Outside of that, we have all the modules. We're actually making some changes here at Halifax, and we're in the process of going to 6.1. The code's already been delivered, and we have access to our subject matter experts today. And essentially, we're going through training, and we're going. Our goal is set for October 1st of 2016. And right now, we're assessing an ambulatory EHR vendor. LSS was somewhat subpar, and our physicians are still leery of it. So we had to go through an assessment to prove that Web Ambulatory was not LSS and a much better product, and we're almost through that. As far as our objectives for 6.1, and these are really important to this conversation, is we're going to go for MRAM Stage 7. And the Passport product that Kipper talked about is really going to help us get there. Meditech can't do everything electronic. However, Meditech's partners like Access eForms have the ability to add, that functionality that we need that will be shown later on in the demo. The other thing is we're redesigning all of our workflows as part of 6.1 to really meet Meditech's best practices and their evidence-based standard content. And our main goal is what Meditech's goal is, which is one bill, one patient, one record, one bill. And then we're also going to cluster our system when it comes to 6.1. So when it comes to Access eForms, as Kipper said, our relationship started in 2006. And at that time when it started, it was really due that we had just purchased scanning and archiving from Meditech, and we really had two issues on the table. First was we had all these pre-printed forms everywhere in the hospital, and if you look at the screen, those are the reasons why you should not have pre-printed forms. And the second thing is we needed a way to electronically route our forms into scanning and archive into the electronic health record. And it had to be electronically routed. For us to try to do that manually would have been a disaster. So we went out and looked at vendors at the time, and Access had the best solution. Another important thing they had, too, is they had a roadmap of where they're going. And you can actually see this roadmap in the demo because it shows the next steps of going to electronic signature and then their new and great thing, which is Passport. So that's us. So as you look at this, I'm going to jump more into presentation now. But if you had a minute to check out the slide, and so this is where we were in 2006, and we had been live with Meditech for about 5 years. Patients were frustrated because we'd ask them multiple things. We'd have to write it down multiple times. We would have delays in updating existing forms and new ones, and we would actually be afraid to make changes to forms because we knew that if we changed a form, we would have to roll it out to the entire organization. And let me tell you, nurses and registrars are really good at hiding old forms, and we're using them when they want to. And then that gets us a little trouble when it comes to our regulatory agencies that govern us. And so version control is an issue. The other thing it did, too, is that the staff members had to go get these forms, hand them to the patient. And so our registrars and even nurses, when we did consents by the bedside, had to leave the patient. And everyone knows today that we're entering this era of healthcare consumerization, which means is that we have to be the best hospital in town and not only provide the best care and the best clinical outcomes, but we have to have the best customer service for our customers, which goes back to patient satisfaction and patient engagement. And so we really need to be by the patient or the patient family members when we can be. So to have to leave them to go get stuff and come back really is problematic. And then the last couple of things is about scanning and archiving. If we go to the next slide, here's where the successes of when we actually went to using e-forms on demand. The first thing and the greatest thing was that once a patient came in, now you could actually pre-print their forms with their ADT information. And so instead of asking them what's information, you got to verify. The other thing is we got that barcode on the forms. And so we still have a manual patient record at different points. And so you needed that barcode because it would actually, through our scanning systems, it would take that, after it scanned that image and made it a TIFF file, it would actually put it into the patient's record in the EHR. And then the other benefit is that only current versions are used. So when Holly, our forms guru, goes in and makes a change to a form, it's across the organization because they print forms on demand. And the other thing is we got to stay in front of the patient because we didn't have to go get forms. They're actually able to print them straight, to the patient as they were either registering them or doing consents by the bedside. And it also reduced storage and getting rid of all those old forms. So now, and everybody understands that, but instead of having forms in shelves and in different areas or in someone's desk, now they were ready to go electronically when they were printed by one of our team members. So the next step, which was really a great step for us, was going to patient electronic signature. And we're actually still deploying this on different areas of the hospital, but it's a really great thing. Any of you out there that are, I'm sure everybody's aware of, now we're starting to get lean in healthcare. One of the main reasons we have to get lean is that there's no more, or I say no new money when it comes to CMS, which is in most cases probably a large percentage of your payer base. And so you have to get more efficient. Electronic signatures is the definition of efficiency. Instead of having, and you can read through this, but this is what happens when you do not have an electronic signature. And the other thing is that there's a lot of touch. Even though now you are able to print forms on demand, you still have to print the form. You have to give it to the patient. The patient has to sign the form. Then you give them, they actually print two so they can sign both. They keep one, then you have one. Then you take that one back. That goes in a bin, later to be filed in the patient record. It gets to the patient record at some point. And then once the patient's discharged, we take that patient record and scan the form back in using that great barcode that I just talked about. Then you scan it back into the patient record, and it sits there as a TIFF image and scanning and archiving. So obviously there's great advantages. And for us, this was a big deal. Sorry about that. Halifax Health, we have a very large ED there's 150 beds in our ED, and that's actually probably greater than 35% of Meditech's customer base when it comes to hospital bedside. And when we have 120,000 annual admissions a year, and we average 4 consent forms just on registration, that's 40,000 e-signatures a month. And that's a massive number. But you think about that, that was 40,000 pieces of paper, actually 80,000 because we printed out one for the patient too. But those 40 had to go through that process I just talked about, which is time consuming when you look at that sort of volume. And then if you make that an annual volume, which is going to total over 500,000 pieces of paper a year just for consents and ED reg, that's a big deal. And so patient electronic signature actually eliminated that. And it was incredible. And it took a little time to get it sorted out because you're dealing with two vendors really, which is Meditech, and you have to buy the cold feed interface and then Access eForms. But I will say it didn't take too long, and once we were able to get through all the kinks, it's been working flawlessly since. And that's a huge amount of numbers, and we actually don't have any fallout for that throughout the month when it comes to getting electronic signatures. So here's some of the advantages. The time and date stamp is very important because that's actually part of electronic medical record. We actually complete the admissions packet at registration. Everything is signed. If the patient would like a copy, we give them to them, and it's really only about 10% of the time. So that reduces the amount of paper we were actually printing from 1 million pieces of paper a year down to the 10%, I guess, represent about, it's still a lot of paper, but it's like 50,000 pieces of paper a year. We eliminate the delays we have. The other thing is we've collected all the signatures because we know we have, because it's part of the group of it's part of the packet. And then one of the most important things to me is running the technical side is we have a tremendous amount of storage space savings. Essentially, if you purchase this, when you store the signature, it takes up about 10 kilobytes because it's literally just the signature. In scanning and archiving, if you scan a black and white piece of paper, it takes up about 150 kilobytes. If someone in registration decides to change the printer or the scanner to go ahead to 600 DPI in color, that changes that 150 kilobytes to over a megabyte, and that's very bad. And in CS today, we can't control that. And once you actually scan that piece of paper, you get to keep that piece of paper for 7 years. So you just lost a megabyte plus of storage. But if that happens to a lot, then you got to think about all that space that you've wasted because you could have been at a much greater, much less percentage of space being utilized. So as far as going through this effort and what we've learned to date is, when you select an eForms vendor, and I kind of talked about this a little bit, but obviously you want some references from other hospitals, and I guess today I'm essentially giving you that. You want to talk to your vendor to make sure that they have a strategic roadmap, and Access does have one as far as where they're going next and what they're doing, because you should be able to then take that and actually look at what your strategic roadmap is and marry them together, and hopefully there'll be benefits down the line. If you're talking to a vendor and when you ask them what their strategic roadmap is and all you hear is crickets, you should probably end the call because they're not going to stay around long. When you do decide to go to an eForms vendor, make sure it's not only IT. Another thing that one of our tenants in IT at Halifax Health is that we don't really push technology. We let our departments decide that they need something, and they may be on a call like this, or they may be at a trade show or a conference, and they see something that's really neat that would make them more efficient. So that becomes an idea, and then when they come back, they end up talking to our project management office in IT, and we turn that idea into a potential project scope. And then what we do is we make sure that the department's selecting the right vendor and that vendor will easily integrate with our technology. And the great thing about that is when you have other departments come up with their technology needs, your adoption's much better because they actually own it. It wasn't an idea from IT that that we want to do because it looks really neat and fun, and then your adoption's much less. So you definitely need a cross-department committee. You may do this at your hospital today, but at Halifax, we actually have a cross-module team. And what that means is when it comes to supporting Meditech, the IT department supports the base, which is MIS, Universe, SIS, and the EMR. But outside of that, we have team members that work in departments across the organization that support their own modules. And so in the case of supply chain services or the materials management module, there's a staff member that spends time doing purchasing activities, but they also configure dictionaries and optimize the materials management module within the department. And then Judy Steiner, who's our application manager at Halifax Health, she manages this, and essentially they meet once a month, and then when we start doing upgrades, or in this case 6.1, we meet obviously much more frequently. But if you have something like that, you need to pick some people from that team to help you find the right vendor and make sure that you're addressing all of the requirements across the hospital. Here's some advice when you implement e-forms and signatures, and even the passport product too. We're not really talking about that yet, but I would say the same goes for that. First and foremost is if you have a PMO, definitely use it. Project managers do this day in and day out. But when it comes to specific things, first thing you want to do is standardize and consolidate your forms and delete the ones that aren't necessary. You may have all done this as part of CPOE and creating order sets for meaningful use, but you also need to do this for your forms because forms just get created over a period of time, and there might be some that are very close, but for whatever reason, someone wants another one. When you go electronic, you want to be able to manage a smaller amount of forms and make them more effective. The other thing is you definitely want to do a phased deployment. In our case, as I mentioned earlier, we started our 80-bed hospital down in Port Orange, and we made sure the system worked down there, and then we moved it up to our main. Of course, have a test environment, and then the other thing is that you need to push it out. And so what we did was we used our cross-module team really to help train everyone and train the trainer, and that also gave us continuous feedback, so we knew that what we were doing was correct. Then once you're all done, you want to look at it again. And so once the project's closed out, I would say that you want to go back in 3 to 6 months and evaluate it to make sure that your initial objectives were met, and to look at ways you can optimize the system. And this is where you can really start looking at, the better lean processes to make the system even better than when you put it in. Some of our lessons learned. Obviously, this happens throughout hospital systems. No one wants to change, or they're very resistant to change. It might just because they're used to doing that way for many years, or the change you're making may actually affect their job and they feel threatened. So you need to figure that out early on and see where that is. And then what you need to do is show the benefits of why we're doing this. It will help either the threatened individual or the person that just doesn't want to change. You have to get rid of all your old forms. I think it took us like 6 months even after we went live with it, where we were still finding forms, and people were attempting to use these forms, and these forms didn't have barcodes on them, so when they went into the patient record and they got the HIM was like, what do I do with this? And so we had to create special barcodes to make it work. And so you almost need a task force to go out and just find all the forms. And they're going to be in desk drawers. The file cabinet will probably be empty because they know that that's where you look, but there'll be nooks and crannies where they'll be at, and you need to definitely find them. One way to help solve this problem is to have some champions in each department, and they can go out and help find forms, and they can also go out and help sell or show the benefits of what you're doing. And the other thing you have to worry about is downtime, because now you have electronic forms. So what are you going to do if the system goes down? And so we actually do have downtime PCs that are disconnected from the system that allows us to still print forms off, obviously without the ADT information, but at least we will have the forms in case of a downtime situation. And then there are also some other benefits you can get from other vendors for that too. All right, so what does the future look like? So what we want to do is move away from forms at all, because now, thanks to the Apple and their introduction of the iPad, is that the world's turned to tablets, and so we got to start using them. So Access eForms came up with a great solution for this. Well, even prior to this, we're already paperless, and some of my peers that I'm speaking to right now, I'm sure, have this technology today. But as far as our patient monitors, today most of us are taking the patient monitor data, we're flowing it through some sort of server, and then we're actually letting the nurse look at it through Meditech, and they can decide what they want to see, and they can make changes to it, and then they can actually push it into the EHR or EMR. And so the technology is there. We're doing it today, so why shouldn't we be doing it everywhere? And so what Access has done is really looked at going completely paperless. And so we go from the paper form, but now the paper form is an e-form and it has fields in it. And so it's actually going to allow the patient to enter their data from a tablet or from really any type of device. And then once that data is put into the form, it's sitting in a database. I didn't create this presentation, by the way, but it's really great. Through HL7 or through the database itself, now we can take that data and push it right into Meditech. And the patient got to enter it. And we didn't ask twice about it. And so that really helps when it comes to patient satisfaction. It actually starts with patient engagement, which is a very big term that's out there today, which means to empower the patient through education in your processes so they can better help themselves in their own health care. And so this is really the beginning point. And so instead of having to wait in line, we can hand them a tablet or an iPad as they're sitting in the ED, and they can get started. And actually, Lewis is going to talk more about that in a second. So I'm going to have Lewis talk about this section here, which is going completely paperless and what it's going to do for us.
So yeah, some of the bigger points here, reducing risks and costs of paper. With paper forms, there's always a chance of something getting lost, something getting misplaced, paper getting filed into the wrong patient's chart. I mean, we've seen all kinds of issues pop up from just years and years of dealing with paper. Now with this solution, we've got a system that really is not just more efficient, but also reduces risks long term of having data go into the wrong patient chart or just information being released to the wrong people. Another thing too is that we tend to, on the tech side, we tend to miss the human element of the technology. We've all either have been in the hospital or had loved ones or friends that have been in the hospital, and we know that, when you're in there, the last thing you really want when you're trying to go home after you've spent the night in the ER or the ED, you don't want to sit down and fill out 10, 12, 15 different forms. You want to go home, you're tired. Now with the tablet technology and everything else, the patients can do it in the comfort of the bed, and they get the nice touch where someone can come in, sit down, and have the time to explain a form. They can fill out a few fields, tap a few boxes, sign with their finger, and kind of go about their day and not have to worry about the paperwork. And as we know, we know that it's a lot easier to just kind of hold on to a tablet rather than filling out form after form after form, and it's the last thing you probably want to do when you're sitting in the ED. Also, it gives our staff more time to do what they do best, and that's take care of the patients. When you're not having to fill out, sort through different forms, file different things, scan, and trying to file all the different forms, it gives you more time to sit down and explain what's your patient is filling out, and just be there and help increase your HCAHPS scores by taking care of the patients and focusing on their health and not necessarily on their paperwork and their backgrounds, and asking them all sorts of different questions that they can easily take care of when they're filling out it on the form. So.
All right, thanks, Lewis. The other thing we talked about too is that part of this is that we plan on reaching MRAM stage 7, and in order to do that, we have to remove as much paper as possible. So Access eForms is going to actually help us do that through their Passport product. Here's some just examples of potential forms for us, which are outside of the norm for Meditech. This wouldn't be an assessment. And it's not just patients signing a form, it's actually just for like care coordinating rounds for intensive care, as you see in the form on the right. And this is a view of Passport, which is a web-based system. So not only can we put on a tablet for our patients to utilize, but we can also utilize it on our WOWs or on tablets for our nurses and when we're doing care coordination. And the one thing that EMRs did in general was when they first came out, they didn't address the mobility of clinicians and physicians because we were having them go to a PC, either a desktop PC, or I said, wow, we can put one on a cart. Now that's a wow, but you're not as mobile as you need to be. And so with the inception of tablets, and even, who knows what we're going to have in another 5-10 years, it's going to really allow our clinicians and physicians to be back to being mobile and being right by the patients and still perform their functions. So IT is not going to be obstructing them. It's actually going to be a tool that will be enhancing their patient care. And here's another form, too, where it's not just for clinical stuff. We can use it for a contract cover sheet, or you can use it just for emergency contacts. So, we have a lot of great things that we plan on using Passport for, and I hope that all of you see what we saw and do the same. So that really concludes my part of the presentation. And if you all have any questions, in addition to Access answering them, Louis, Holly, or I will be glad to answer them too. Thank you.
Great. Thanks for the time, Tom. I really appreciate that and that presentation. I know Lindsay is on the line, and I know she's been hit with you've been getting a lot of questions through the chat box. Please continue to enter those in. But we're going to stay on until we get all questions answered. Again, that chat box is within your go-to meeting window there, and just type that in, and we'll be able to address those. So, Lindsay, I'm going to turn it over to you and can allow you to field those questions.
Great, thank you. Yes, we have received quite a few questions, so yes, keep those coming in. We'll just go down the list here. So the first question I have for you, Tom, is have you looked at scanning ED sheets in the ED immediately on disposition?
I'm not sure of the term ED sheets. Our ED is completely electronic at this point. We just had to finish off with the consent forms at Reg and by the bedside. So we use the EDM module completely today. We actually don't have a paper record in the ED.
Okay. If the person who asked that has any further info for Tom on that one, just type that back in. The next question is, what type of devices are you using to collect electronic client signatures? And are you using tablets to collect signatures for something like bedside consent?
Today we use the LCD pads that are recommended by Access eForms. Once we put in Passport, we'll go to tablets.
Great. And I'll add to that, and like Tom said, the Passport solution allows for additional options in terms of devices. And so it really could be an iPad, it could be an Android device, it could be an HTC tablet. There's really, it kind of opens that up with those web-based forms, so there are additional options going that direction. So.
Okay, the next question for Tom was, what was your ROI time?
I'd say within a month. Our ROI was really based on paper savings and the time reduction of the paper-based process I talked about. We could easily measure the paper savings because we actually didn't have to purchase all that paper anymore. And the timing was something we just, we couldn't measure it that as well as we wanted to, but I'd say within 1 or 2 months we were good.
Okay, the next question is, When we are giving the patients the tablets to enter their data, are they writing it in with an electronic pen or typing it?
Kiefer, I'll let you handle this one, but
Yeah, definitely. So with the tablet, with the web-based forms, and the Passport world would have the capability, if you want to provide them this, to enter in data, check boxes, sign with a stylus, and those sorts of things. So those web-based forms provide that really kind of patient interaction for those consent forms. So if there are specific fields that they need to complete, whether they be text boxes or drop-down lists or radio buttons, those sorts of things, you guys can define that and build those forms accordingly with the web-based solution.
Okay, thanks, Kiefer. The next question here is, what cost savings have you realized in paper and ink, a general estimate?
I really don't know the answer to that. I could find that out and send that to you.
Yeah, we'll work with Tom on that and provide that to the person that asked that question.
I mean, it's roughly 900,000 pieces of paper. So whatever that would be. And then the ink associated with it. And I guess the average, depends on what you're, I mean, so we were, based on our volumes, we were able to save from printing 900,000 pieces of paper. So you have to take that and look at what your price per print is, which you would have to include your, what you pay for toner and maintenance for all your printers in an organization. And that was based off of our volume. So it's, we were able to get down to essentially printing 10% of what we used to print 100% of. So I guess you can take that equation and figure out what your savings would be at your organization.
Okay. Next question is, do you have time studies on how e-cig saves time in registration?
I don't personally. I'd have to talk to our director of patient registration to see if we did that or not. And again, if I can get those, I'll send them to Kiefer and he can send them out.
Okay, that's perfect. Next question is, were there any issues with wireless bandwidth for the LCDs, and do you anticipate any issues once you start using the tablets?
They're USB connected, so it's actually connected straight to the computer. I think when we were building it up, we had some issues just that was really based on what the OS was and everything. But today we have no issues. And as far as wireless issues with tablets, as long as you have a homogeneous wireless network that is enterprise rated, you shouldn't have an issue at all. Our guest network probably airs 500 Netflix movies at any given moment in the hospital today. By patient families, not by team members, of course.
Okay, that is a lot. The next question that is here is, in the ED, are discharge documents printed from the EDM then assigned by patient and nurse?
I don't believe the nurse and the patient signs our discharge instructions.
That's one now they upload to the patient portal.
Yeah, now we actually send them up through the portal. And then based on meaningful use for electronic summary of care documents, they actually flow to our HISP and out to physicians too. If the nurses and patients do sign the discharge instructions, we are not doing that electronically today.
Okay, thank you. What imaging system do you use, or is that eliminated once you implement Passport?
Not sure what they're asking about imaging system. We use scanning and archiving today to scan in forms. When we get to the point where we have no paper, obviously scanning and archiving won't be needed anymore.
Archiving will, scanning.
Yeah, scanning won't, archiving still will be. Thank you, Louis. And when it comes to imaging, when I think of imaging, I think of PACS, and we use DR systems. And obviously that wouldn't be eliminated.
Okay. This question might be for Kipper. Can you explain the difference between eForms and Passport?
Sure. Yeah, I can definitely provide some clarification there. So what we've been kind of referencing and what Tom and Halifax started with were our traditional pieces where we focused on automating the registration process, all right, and printing forms out on demand. All right, so that's kind of the Access eForms started there to where you could manage all of your forms electronically, and as you needed to print those out, demographic information and barcodes could be populated onto those forms. We added onto that its own patient electronic signature solution for kind of that registration ED area. All right. With the Passport, we leveraged some of the traditional pieces like the EFR and e-signature and expanded that and added in the component of web-based forms. So Passport is, think of it more of as a centralized dashboard to manage forms throughout your organization. So in one location, you can go in and launch a clinical form for David Friday out of EFR, and that form be a web-based form. David Friday's information can populate onto that form, and you could capture his signature at bedside on an iPad. In that same view, in that same world of Passport, as an employee, if you needed to submit a personal time off request, and you guys had those built within our web-based form solution, you could go in and launch that web-based form, fill that out, and submit that onto your supervisor for them to review and approve and then send on to HR. All of the forms that you're responsible for that maybe you need to sign off on if you're at the director level and you need to approve maybe those personal time off requests, we have an internal inbox, essentially a dashboard for you to manage forms that you are responsible for in order to approve and sign on and send on through the workflow process. So in the traditional sense, the IFS, EFR, patient electronic signature, was focused on eliminating those pre-printed forms at admissions and up on the floor and providing a way to print forms out on demand. Passport is kind of that next step, right, and allowing you guys to move to a true paperless environment. And we're leveraging some of those traditional pieces and kind of welded those together to make a centralized solution.
And I don't know if I emphasized this enough during my talk, but now, because like Louis just mentioned, when you fill out a paper form, it can take days before that data actually hits a database so it's available to everybody else. Where with Passport, it's going to be seconds or milliseconds actually once you hit submit on the form. And with the workflows behind it, you can also have approvals electronically through AD authentication along the way.
Okay, thank you, guys. The next question I have for you, let's see, what is your licensing structure?
I'll take that one. So we have a couple of different models in terms of what solution you guys are moving forward with. On the Passport side, we have Passport as a whole and individual fillable forms, web-based forms that you guys may need, and then the other solutions are based on bedsides. But we can, whoever is asking for that information, we can follow up and get you guys detailed info on how that is licensed and structured.
Okay, thank you. The next question that I've got are so many. Let me figure out which one I'm asking. Do you use this for ambulatory surgery consents and other surgical documentation?
Yeah, we use it for consents. If you have LSS today, we can't do electronic like registration in the offices. It's not Access eForms' fault. It's actually Meditech's, the integration between the cold feed interface, and LSS is not there. And for us to actually do it, we have to get accustomed through LSS.
Okay, thank you. The next question is, what biometrics of the signatures are collected from the patient signatures, specifically on tablets?
I can address that as well. So we're capturing the speed, stroke, and pressure ratio of a patient signature through the devices for the patient electronic signature solution.
Perfect. Then next question is, do you have outside physicians who require patient data for their billing purposes? If so, how do they receive that information?
I really don't know the answer to that. That would come from our patient financial and billing office. So.
Okay. The next question is, with Passport having the capability to collect signatures on tablets, is there any biometric data collected with the signature the way the LCD tablets collect?
And that's a great question right there. With the web-based forms and the iPad, the way that those tablets are constructed, at this time, we are not capturing that biometric information. So on the walk-on LCDs and the tablet PCs, we capture all of that biometric information. On the iPads and the web-based forms, because the iPads are essentially recognizing its heat and touch as opposed to pressure, we can capture the graphical signature, or we can capture a digital signature with a username and password and verify that as an Active Directory. So we have a couple different options in terms of how we can capture that signature through the web-based Passport forms.
All right, thank you. We have a couple more questions here. With Meditech, what is being used for ED face sheets?
We have a face sheet in eForms, and it's also in Meditech.
Yeah, and I can talk to kind of that process there. So what we're essentially, they built this face sheet within the Access eForms IFS piece within the design tool, and Meditech is sending that input file or initiating NPR report print stream to the IFS server to kick off that face sheet, as well as the additional forms that need to be printed out or initiated for that patient.
Okay. The next question for you, Tom, is what other vendors did you evaluate before choosing Access?
There's only a couple out there, so I really don't want to say any names.
Okay. The next question, Kiffer, are there 3 different companies, Meditag, Access, FM, and Formata?
There's 3 different, Meditech, was the first one Meditech? Sorry.
Yes.
Just wanted, okay, all right. So yeah, I mean, Meditech is its own separate entity. Formata is actually a subsidiary of Access. So Access eForms is kind of the overarching, and Formata is it's actually a new story. In 2010, we went out and purchased Formata. They were a web-based forms design company, and we went out and purchased them and implemented and built that, integrated that into our solution, and that's kind of what drives some of that web-based form technology that we have today. So Access and Formata are related. Meditech is separate.
All right, perfect. There's one last question here for you, Tom, and then I'll have to pass it back over to Kiffer. to close. But last question is, how are your ED physicians documenting? Are they documenting on tablets using the Passport solution and a digital version of the ED face sheet, or documenting with EDM?
They document in EDM, and we utilize physician documentation essentially, and nuance for dragon speech. We have order sets built in Meditech. It's completely electronic.
Awesome. Thanks, Tom. I appreciate that. And guys, I just want to kind of close down here. I know Tom and those guys have a hard stop coming up, and we definitely need to let them go. But I just want to say definitely a word of thanks to Tom and your team, Lewis and Holly, you guys being on and talking about your story and what you guys have done with the access solutions. You guys are definitely one of our rock star accounts, I guess you could say, and we just really, really appreciate your time today. Everyone else on the webinar that had the questions and listened in, just thank you guys as well. I know everyone has a ton of projects and are getting busy, or very, very busy this time of year, so I appreciate your time. Please feel free to follow up with us. We'll be following up with you guys actually with an email with contact information and all of that, so you can follow up with us as needed. You guys can also visit us at HIMSS, so if you're going to be stopping by and going to Chicago this year, please stop by and visit us at the 2256. Again, 2256. We'd love for you to come in and see a demo of some of our traditional pieces as well as the Passport environment as well. So again, guys, thank you so much for your time. We really appreciate it. Hope everyone has a wonderful Thursday afternoon and evening. All right, everyone, take care. Thank you.